I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Welcome to Hopeful Hands. I'm your host, Dr. Tara, and today we're going to continue our conversation based on our patient, Krista, last week. If you didn't listen, there's so many areas of her story I feel you will resonate with. Let's dive in, though, to PCOS and infertility and the connection with that, as that was Krista's main diagnosis. So we know that PCOS is a common health condition. It affects approximately 1 in 10. And I would say more because in my office every day, women come to me and they have either not received it and they very obviously have it, or they were told they maybe kind of sort of have it, which I don't understand. The healthcare providers who are saying kind of sort of maybe looks like either they have it or they don't have it. And you as a provider just are unfamiliar with how to make this diagnosis. So it really puts this delay in the fertility space. And truly, it's one of the easier things in my practice of fertility to treat. We need to get you ovulating, support your progesterone, make sure your husband, spouse, partner has been checked out too, because that gets missed all the time. So, really, the oversight is often from the healthcare provider and accurately making that diagnosis. It can really lead to women who are unaware they have the condition, delaying conception time, and really initiating that appropriate treatment ASAP. So, PCOS affects women in various ways, including irregular menstrual cycles. Again, I'm going to put here you could be getting a period and still have it. It's the anovulation piece of it. You have excess androgen or male hormone levels, and you may or may not have actual physical polycystic ovaries. So, again, this is where I say you do not need that ultrasound to make the diagnosis. That's not part of any diagnosing criteria out there in any aspect of the world. It can be that and or that or. And so that's where the confusion, I think, lies as well in the healthcare community. So clinical symptoms, along with looking at lab results and ruling out other possible reasons why you're having the symptoms that are presenting. So helping you ovulate for fertility. And it makes it challenging to conceive at times if you're not ovulating or you don't know or you're unsure of how to track your ovulation as well. So I'm going to give you some tips for managing PCOS that are going to enhance your fertility. And if you suspect that you have it, please find a healthcare provider who understands fertility and PCOS and grow your team. You can have more than one, more than two, more than three people on your team. You get to create that team. And so number one is really just movement and really understanding your insulin levels. And it can really have a positive impact. One of my favorite social media people is called the Glucose Goddess, and she talks about even 10 minutes of movement within an hour after you have a meal. And she even says how if you're sitting, you can just sit and move your legs back and forth too. It doesn't have to be a huge workout. It can just be up, moving 10 minutes, go take the steps. I have a walking pad that I use as well because we really want to help with insulin levels and support insulin levels. This is huge for helping with your menstrual cycles, enhance ovulation. Number two, my favorite thing is increasing your protein intake. Many come to me and they're not even eating or they don't know what to eat. And so we want to help increase that protein to help maintain hormone environment. It's really just, we want to also make sure you're eating every 3 to 4 hours. I'll leave that as tip number three. They'll all kind of go together, right? So when you first come into our practice, we're not throwing these huge dietary, calorie restrictive, eat this, don't eat this at you. It's number one, eat every 3 to 4 hours. Number two, protein. Number three, walking, movement, something very basic. We don't need to go and get you to join this new fancy program or regimen. If you want to, you can, of course, because my other rule is you must enjoy the movement that you do and really just find something that works with your schedule because your schedule, your friend's schedule, your neighbor's schedule, my schedule are all going to be different. And so again, finding a routine that supports eating every 3 to 4 hours, protein, 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 every meal, every snack, taking a bite of that fiber and or protein first, and then movement, especially after eating. Also consider supplements. So this is we'll just say sticky area. Of course, disclaimer, talk to your healthcare provider before starting any new supplements. But the most common ones are myo-inositol. And I've really been upping the dosing of that for many of my patients in our practice too. It helps with insulin sensitivity. It helps with fertility, ovarian function. I love omega-3s. I love vitamin D, especially in the area where we live. And so really finding that regimen for you after you've had lab work done or certain testing done as well. We do a lot of Dutch tests in our practice. It's knowing what's best for you, what's needed for you. Okay, number 5, let's talk. I should probably this is number 1. This is one of my favorite things is having an at-home hormone tracking system. And not just the stick, divorce the over-the-counter, LH only, blinky smiley face. Bleh, gone are those days. It has to also check your estrogen and more importantly, your progesterone. And so I'm going to link my favorite ones in today's show notes. And you can see the ones that I support and approve of that we use in our practice. We even use them to help with IUI timing and treatment for that. I can't express enough how crucial it is that you understand the exact timing of your ovulation because it fluctuates and it's normal for it to fluctuate by a few days. But if you miss that, you have that short window 24-ish hours to capture that egg release. And so it's really important that you pinpoint that time down, but more importantly, that you see a progesterone spike 3 to 7 days after your LH spike. That's going to tell you, did you actually break open and release an egg? The corpus luteum releases progesterone. So you can grow a follicle and have an LH surge, but you may not ovulate. It's that progesterone check. And gone are the days of day 21 progesterone checks. I call it 1995 medicine. Those are not accurate because every body and every month is normal for it to be different. So it really just allows you to be at home, wake up in the morning, do it. Many of these programs have back end systems where your healthcare provider who oversees your fertility can actually see your charts at home or from their office, from your home to office. And so it's really come a long ways and really makes it easy to do these things at home. Number 6 is seek support. So dealing with PCOS and infertility, it's emotionally taxing. It's exhausting. It puts a strain on relationships. You have to have the right healthcare group, the right support group. Consider counseling. In my practice, we have mental health services. We have access to support groups. And just think there's many times where I found myself like, I'll just do this alone. I don't want to bother anybody. And God are those days. I want you to know that there's a team out there for you. Social media is huge for connecting with people that you guys want to communicate, stay in touch, make connections with others going through it too. And it's super valuable and important for your journey. Number 7, we're going to talk about is exploring the benefits of semaglutide. So originally this treatment was used for type 2 diabetes, but it's shown very promising improvement in managing PCOS symptoms. And I can raise this from my office as well. When I have done everything under the sun, natural, medical, to try and get even a period on a woman, I bring in this medication or tirzepatide, which is a different format. I call it the bougier version. We're getting periods, we're ovulating, we're getting pregnant. It's amazing and wild at the same time. So really what it does is help balance those insulin levels. And it really, in turn, is helping the woman ovulate. And when you integrate this or any new treatment, it's critical to have just a really thorough understanding of side effects, risk benefit profile, monitoring. We do really close monitoring. It's not just here you go, give me your money, walk out the door. You are coming every 6 to 8 weeks, more likely every 4 to 6 weeks if you're going through infertility. We're monitoring, adjusting, we're watching for side effects. And then we're doing fertility as well. And so we really have a cutoff time too for fertility with the timing of this. And so it's work with a healthcare provider who understands this and fertility because there's a lot of conflicting stuff out there as well on that. So really just find a provider that can really assist you appropriately and guide you through it. And again, maybe it's more than one. Grow your team, have multiple. Number 8 is consider traditional Chinese medicine and acupuncture. It's something we utilize a lot in our practice. Personally, I use it as well. And it just helps so much with a lot of my symptoms. But there's been studies that actually show that it can help improve menstrual irregularities, reduce symptoms of PCOS, improve your hormones. There's a couple providers I've checked in the past, and they can actually use the at-home ovulation tracking and hormone tracking and really help time their treatments with it as well. And it's just really helpful a lot of times too for symptoms. So with that, I just want to let you know PCOS can really present some challenges, especially in fertility. And knowing you have it is probably the hardest part in getting that diagnosis as early as possible. And if you know you have it, it's working with somebody to ensure your hormones are balanced and ready for fertility before. So if you're listening to this and you're like, I'm not even ready to have a baby yet for a while, it's now. Now is the time to actually start looking into that because we want to balance so that when you're ready, you can just, I'm ready now, roll into it. We have a system in place. You know, your hormones are balanced and it's really you're ready to navigate that next step into parenthood. So thank you so much for listening to today's episode. We'll see you back here next week.